Lately we're seeing a lot of distance runners, 5K, 10K, half marathon, full marathon, coming in with a multitude of injuries. But usually when people are starting an exercise program, shin splints is one of the major things that we see. So there's two major flavors of shin splint. We've got an anterior right in front, and we've got a medial right on the inside. And both of those are pretty painful and can stop you from your goals. Now, ultimately, what's causing that is usually a combination of foot biomechanics. Usually people are too forefoot running on their toes, and a combination of relative weakness in your feet, as well as ramping up mileage too quick. So any one of those three, or all three, can be causing your symptoms. So the first thing we've got to do is to rule out any red flags. So red flags are just the scary stuff that would worry us. Ultimately, for a distance runner, most of this isn't an issue, but sometimes there's a deep vein thrombosis or some neurological condition that's coming from the back or higher up in the body. Next thing we'll do is check out neurology and just ultimately see if there's any peripheral nerve damage or anything like that. Ultimately, we'll take you through a McKinsey evaluation, which is a repetitive movement process that is looking to figure out a way that you can help yourself. Additionally, we add a movement-based analysis that is focused on looking at your whole body to figure out where you're most deficient in your movements or most dysfunctional. So we combine all of these in addition to strength testing to figure out what's the biggest problem. Where do we need to focus most? After taking a detailed history and adding that with your exam, we'll come to a pretty good conclusion and a diagnosis about where to move forward from there. Once we have a clear diagnosis, then we can focus on treatment. So at Performance Therapy Group, we've figured out that a combination of chiropractic and joint mobilization techniques, as well as soft tissue techniques like deep tissue massage, trigger point, active release technique, to name a few, as well as corrective exercise, often called rehab or rehabilitation, that combination works synergistically much better than any one of those by themselves. And so if you leave one of those out, then patients just typically don't get better as quickly. So specifically for shin splints, what we'll be focusing on is first, just to make sure your ankle is moving well. So chiropractic adjustments to mobilize and adjust the ankle and the foot, as well as the hip and everything in between to figure out, or just to keep things moving smoothly. Next, we'll focus on the soft tissue work, which I find in shin splints is one of the major parts. Now, it's not typically a comfortable technique because we've got to get in there and loosen those really tight and inflamed tissues, and that takes some pressure. And so we will do that as well as to show you how to work those tissues yourself. And so lastly, we'll show you some stretches that will help you just to kind of slowly loosen everything up, because oftentimes when those muscles are in spasm like that, they're just rigid and tight. And so you can be doing a lot yourself to significantly help loosen all those tissues and get feeling better faster. So just because your shins are hurting, and sometimes really badly, doesn't mean you have to stop training. It just means you need to change the way you train for a bit. If you'd like help with that, give us a call or check out our website and request an appointment online. We'd love to help.